Great privilege that I get to introduce Michelle Paradis, who is the Communications and Community Outreach Coordinator at the Ottawa Hospital mHealth Research Team and CANImmunize. Her role involves working with her team to develop content for marketing materials and websites, as well as connect with healthcare professionals across Canada. And as part of this team, she works with Dr. Wilson, who is Chair of Public Health and Innovation at the University of Ottawa, and he's a professor in general internal medicine, and he's here as well. In addition to CANImmunize, Michelle holds a clerical position in the emergency department at Civic Hospital, which continues to fuel her desire to work in public health. She believes we are at a time when technology and medicine can be combined to help people manage their health information, and the tools created at the Ottawa Hospital mHealth Research Team are examples of this. Michelle holds a BA in Communications from Carleton University. Michelle, welcome.
Thank you so much. Thank you, everyone. Thanks for having me today. So I will be talking about CANImmunize, which is Canada's nationally endorsed immunization app. So just a brief outline. I'll talk a bit about how we got here, how the steps that we've sort of taken in order to develop this national immunization app for Canadians. A couple of things that you can expect from CANImmunize at the population level in terms of being able to manage your immunization records. Of course, at the healthcare level for enhanced communications around patients' immunizations, and then of course the public health level. We'll talk about how we envision creating a mobile tool that's available for everyone, of course everywhere, and then of course we'll get into some opportunities for newcomers to Canada. So our whole story started in a local park in Westboro with a woman named Leslie Keenan who approached Dr. Wilson. She was coming from Silicon Valley, and she said, hey, listen, I can manage everything on my phone. I can get my banking information on my phone. What's up with these yellow cards? Which I'm sure everyone has experienced that. And so that's when Dr. Wilson said, you know what, this is a great idea. So at the time, Cameron Bell was a first-year engineering student at McGill University. And over that summer, so this was back in 2011, he had actually developed the prototype. This is Leslie Keenan here. So he developed the prototype for Immunize On. So Immunize On was sort of a pilot project based in Ontario that would allow citizens in Ontario to start tracking their immunizations on their mobile device. Of course, they would get resources, which right now is really important. It's something that we try and continue to encourage Canadians to do is really come to the platform in order to get expert-approved resources on immunizations. The internet has been a quick challenge for that. So a couple years later, looking at 2014, as Immunize On kind of garnered more attention from public health officials, we were able to partner with the Canadian Public Health Association in order to launch Immunize CA. So this was the first national immunization app for Canadians. At the time, it was available on iOS, Android, and BlackBerry, and we still do get a couple questions and feedback from people saying, why did you remove it from BlackBerry? But today, it's available on iOS and Android. It contained the 26 pediatric and adult immunization schedules across all provinces and territories. At the time, Immunize CA was named one of the top 10 accomplishments from the Canadian Federal Health Minister. And Immunize CA won the Canadian Wireless Telecommunications Associated Connected to the Community Award. We got an honorable tweet from Dr. Eric Hoskins at the time. And then Immunize CA was actually featured in the App Store on iOS as one of the top sort of grossing free apps for healthcare. Right now we're looking at about 180,000 downloads across Canada, and we're averaging about 12,000 monthly average users. The bottom picture here with the Honourable Dr. Jane Philpott, she attended our sort of inauguration when the Public Health Agency of Canada awarded us with $3.5 million to develop CANImmunize over the next 3 years. Where's my slides? So I'll take you through a bit of a tour of CANImmunize. So this is the sort of front-facing app. So the user's information would be stored here on the front page. You'd be able to go in and see all of the different users that are part of the app. When you go into your records, you'll be able to see, you can actually record the entire family's immunizations in one device. And all that's needed is the first name, the last name, the birth date, and the province and gender of the individual, of the user. So this is what the app would look like. So here we have the 2, 4, 6, etc. visits. We've developed a pretty easy sort of model to follow. So if there are green dots beside a visit, it means that the vaccinations have been received. If there's a yellow dot, it means that the vaccinations are due or they're upcoming. And then if it's red, it means that you're overdue. Now, by clicking on a visit and a particular immunization, you can actually toggle the received button to yes, and then you put in the date that it was received. And for every vaccination, we actually link to the provincial or territorial immunization fact sheet. So should an individual require more information, then they can access it there. Now, by turning the phone to landscape mode, it actually replicates the yellow immunization card, which would allow the individual to sort of link the two and make sure that everything is accurate and everything is there on the app. Now, by going into the individual's status page, they can search by vaccination or by disease. So they can make sure that they're all of their children are up to date on all of their vaccinations. And if they do have questions about the diseases, then they can actually go in and read and make sure that they've been vaccinated. One of our notable features is the outbreaks map, which is powered by Harvard Health Map. And they are out of Boston Children's Hospital. And they've developed this pretty amazing tool, actually, that allows users to go in. They can access it through their desktop computer as well, but we've integrated it into the app. So should someone have questions about vaccine preventable disease outbreaks around them, then they can actually toggle the distance, the ruler there, and they could see all of the outbreaks that are around them. We noticed a lot of mumps outbreaks in and around Toronto, so it was quite good to be able to go in and you could see sort of the proximity that you were to the disease. And then, of course, we have other features such as the frequently asked questions for the user. This is sort of a larger theme that we're looking at. It's part of a larger theme where we're really trying to encourage people to, have access to their health records. EMRs are a great example of this. And in so doing, we envision trying to create an opportunity to help sort of the public health system as a whole. So of course, at the physician level, having better communication with their patients and making sure that all of the immunizations are in there for every visit. Of course, at the user level, not only to be able to track, family vaccinations in one place, but also to get or to have access to expert-approved immunization content wherever they are. And then, of course, at the public health level, being able to communicate directly to individuals when there are, vaccine preventable outbreaks, or if there are new recommendations about specific immunizations, such as HPV. So CANImmunize, we launched officially in April 2016. We rebranded to CANImmunize. It was previously Immunize CA. So we rebranded in December of 2016. And we really envision, a mobile tool that's available for everyone and that's accessible everywhere. So accessible everywhere, meaning that individuals will soon be able to access their immunization records across different electronic devices, and then for everyone. So empowering the individual to modify their app to meet their needs, and then have access to all the information and the resources that are required. So now I'll take you to CANImmunize accounts, which is a feature that we're looking at launching this summer. So CANImmunize accounts will provide users with a more secure place to be able to store their immunization records, and then of course a way to access the information from different electronic devices. So for an individual who has, say, an iPhone, they'll soon be able to actually access their immunization information from their iPad or from an Android device. And it, of course, offers us sort of this opportunity to connect a little bit more with our users. We understand that users are frequently on the go and they want to be able to have access to this information. And so we're really trying to tailor it to meet their needs. And then, of course, with CANImmunize accounts, the information and the notification can be sort of tailored based on their province and territory and their city or town. So these are some of the examples of what CANImmunize accounts will look like. To sort of give you a bit of an idea, an account is sort of like something that you create from Google. So you'll be able to access all of your documents across different devices. So we see here you'll be able to still track your family's immunization records. You'll be able to access your records wherever you are. You'll continue to receive reminders when it's time to vaccinate, and this is a great feature for Canadians, especially for parents. With 2 or 3 children on the go, it's quite difficult. So being able to receive reminders on your phone is really important. Continue to be notified about disease outbreaks. Update travel vaccinations before every trip. So this is, an opportunity for the individual to then go to their travel doctor and have, an open discussion about the travel vaccinations that are required. And then, of course, get the facts about immunizations in the province or territory. The user will be able to customize CANImmunize based on their language of choice. So right now it's currently offered in English and French, and we're looking at expanding that to meet the needs of Canadians who speak different languages. The notifications will be enhanced, so text messages, notification through the app, and then of course email notifications are something that we envision incorporating. And of course we're offering a more secure account, right, with CANImmunize accounts that will allow, we'll be embedding multi-factor authentication to sort of allow that. And these are some examples of what CANImmunize could look like. So here we see Dr. Patterson has added an MMR vaccine to Malcolm's immunization record, and that sort of enhances the communication, between the physician and the user. Or HPV is now recommended for grade 7 boys in Ontario, so being able to have those sort of notifications and that information in real time is really important to people. Again, the Saskatchewan Ministry of Health, encouraging people to get vaccinated with a simple question: have you received your mumps vaccines? This is particularly relevant to people in my demographic. We're required to get that second booster for mumps vaccines. And so these are examples of what it could look like. Being able to remind people in Ottawa that the immunization record updates are due by August 15th. And being able to sort of communicate key messages to users in different provinces and territories and different cities as well. Being able to customize CANImmunize is really important to individuals in different provinces and territories. And it's actually quite simple for us to be able to do. So all that's really required is an image to display a title, a byline, and then some content to link to, and then we're able to then put it into CANImmunize, and individuals in those regions are then able to open their phone and see this information, sort of wherever they are. So this is one sort of example. It's the Ottawa Public Health Reporting Tool. So we've been working quite closely with Ottawa Public Health to be able to allow citizens here to send their children's immunizations to Ottawa Public Health. So this came about at a time when the suspension letters were coming out in Ottawa. Same thing in Toronto, and I think this is sort of happening everywhere, and we want to try and avoid that. It's quite a hassle when people say, but I've had my child immunized, and why is this going on? And then of course the doctor is going, as I'm sure you know, the doctor is going, oh, but I have to fax something else, but I'm really busy today. So we want to try and avoid that. But we also want to allow citizens in Ottawa to kind of take ownership of that and be able to send that information off to public health on their own. We are looking.
Can I interrupt you for a second?
Absolutely.
If the patient inputs that they receive, first let me say I think this is fantastic. If the patient inputs that their child has received the vaccination and then they send that to Ottawa Public Health, how does Ottawa Public Health know that it's really happened?
Sure, so right now that's the situation, right? We're replicating the existing situation as self-report at present. So we're just allowing to make that self-report easier. If they're asking people on the phone or fax, we're going to allow them to do it digitally. We're working closely with the ministry. They're implementing something called the PICS, the Public Health Information Exchange, which is the layer around what is going to be PANORAMA or whatever they're going to call it, their immunization repository. And this will allow them to review and validate these records as they come in. It's not a perfect system, but it will allow them to do some sanity checks to be sure this makes sense. So we've been doing that right now through BORN, which is a maternal child registry. And in Ottawa, initially there were some issues, the dates were getting mixed up and stuff. We fixed that in the app, and so they're happy with the quality of the data coming in. Ultimately, this is interim measure, and we're working toward integration actually with provincial immunization repositories where data can flow back and forth more seamlessly, and discrepancies can be identified between records that you've inputted and the records on the system. One of the issues, as you know, with immunization is increasingly fragmented. So your healthcare provider isn't the only person who provides it, the pharmacy is providing it, the school is providing it. So our vision is that the individual is the source of truth. So even if the information that the parent provides is not consistent with what the physician had, that doesn't mean that the physician record is accurate. And we try to make it better.
Do you have a question? Yeah, well, first of all, also I totally agree. This is amazing, very inspiring, and it's great to see that this is actually becoming reality and giving me great ideas for medication management. I have a question about the one where it said Dr. Pattison added vaccination to your child's record. How does that happen? Because for me as a family physician, I trust in our clinic that our records are accurate. Whenever there's a vaccination given, the nurse enters it, it's there, and I know that's been given. It may not be the complete record, there's a lot missing. How does that message happen? Like, is there a link to the EMR?
So,
is there, where does that come from?
That's the vision for the future. As you know, there's legislation going through, although it's probably because of the OMA battle, to mandate physician reporting of immunization status. If that does happen, that information will flow to Ontario PANORAMA instance or whatever they are calling it now, and then there'll be an opportunity to send that information back to the user.
Okay, so
But that's now, I guess that's
for sure.
OMA has rejected that legislation, so that's a bit on the horizon.
So it would come, it would be some kind of automatic pull from the EMRs and then be fed back.
We go EMR to PANORAMA back to the
app.
individual.
Yeah, okay.
I mean,
No, that
our
makes
vision
sense.
is,
That's
in a
good.
perfect world, the healthcare provider, public health, and the individual will have the same information in real time.
Yeah. Exactly. Same thing for medications.
For anything.
Yeah, you look at that model in cancer screening.
We do?
One of the more advanced
Okay.
models is like cervical breast cancer screening. That's, I think, as close as we've got to that model where the
Yeah.
information is
Yeah,
shared back. So
exactly.
it does exist, imperfect, but closer probably to where you're heading than any other element.
Drugs are a big one.
So just so that I can envision it better. So your provider has access to the panoramic, and in there he can view or access the database that from that app, you've entered information, and then that information is sent to panoramic. So meaning that your provider can access and edit probably, I mean possibly sign off if any
So
entry.
right now, that doesn't exist, right? So right now, information resides in your phone. In 2 months, it's going to reside on a cloud-based server. We're going to permit flowing of that data to public health. It's going to go through an access layer called the public fix. Ontario is going to be releasing something called ICON soon, which is a web-based reporting tool and access to a person's immunization records. We're going to incorporate that in the app. We've been working with them. A public health physician could potentially have access to your immunization, or a physician could have access to your immunization records through, if they have access to your personal ID number. And they could get your records there, and they're trying to pass the legislation to get public health, the physicians, to report directly through an ICON type system. But those are visions they've been having, as you know, for many years. They are getting close. Our goal is to work with them and to make sure we can facilitate anything through our app. And as Doug pointed out, we don't have, every province does it totally differently.
Yeah.
So we have the capacity to try to meet the needs of every specific province. Like some places, the public health docs give the vaccine, they even call the vaccines different names. They have different schedules, they have different vaccine information sheets, something as simple as that, right? So it's really, if I had known this was going to be this complicated.
So maybe, oh, sorry. Take one more question.
I think Richard?
Yeah.
I do some alternative medicine in my practice. So I get a lot of people who are what you might call anti-vaxxers, who ask me what they should do. And I always encourage them to be vaccinated, but I have to sort of concede that we don't have enough data on adverse events in terms of proactively going after sort of seemingly minor clinical events that might not be associated by recipients. I'm wondering if there's any talk or thought about using this tool to, I guess, reassure people who have these concerns and increase the uptake of vaccination, just to see that as another potential avenue.
So I mean, one of the things we realized, that I used to do a lot of work in vaccine hesitancy, the 3 reasons people don't vaccinate is fear of adverse events, belief that vaccines don't work, and that the diseases are not around, and more commonly logistics, right? You just forget it. So we've addressed logistics with reminders, notification, and scheduling. We're having accurate information in the app about vaccines. A lot of people don't start out anti-vaccine, so we want to get them while they're pregnant actually, and get them the accurate information so they don't go on the internet. And then the outbreak maps tell you these diseases are around, right? We're actually, and we built a pilot app, and we're going to pilot in this about adverse event reporting through the app to empower people to report adverse events. We think that'll actually enhance confidence. People are worried it's going to. It just tells you, we're taking this seriously. These things happen. We actually even built a proof of concept barcode scanning with the app. So you can scan that 2D barcode, so then you can link that adverse event to a lot number, to everything, and send it. And if there's a problem with a specific lot, you could get a lot-specific notification back. But these are all things on the horizon. But all of this capacity, and I'd encourage all of you to think about this like this in other areas. Like this stuff does unlock a huge potential.
He is raising the potential for long-term surveillance. If you've got that information there, you could be generating for random selection, follow-up, have you had X, Y, and Z, as a way to monitor vaccination,
Coverage, oh yeah, absolutely.
coverage, reactions, et cetera, over the long term across the country.
Yeah, so we just incorporated trade names in Ottawa. So, and we're going to, we want to get more and more specific information about the vaccines in the app, so we can have better data.
Can I, one final question?
Sure.
God forbid you should ever stop getting support financially from the government or something like that, and you go out of business. What happens to the data if this is my only record?
So that's a great question. The under our contract with FAC, they would take it over. If we can't, we're supposed to build a sustainability plan that will likely involve a subscription service for the provinces. Given the amount of money it costs a single public health unit to hire a nurse to get all of these records, if we can facilitate that, I mean, this is a huge cost savings to jurisdictions. I hope they see that. Plus, we'll offer them the opportunity to communicate directly. But if that does not work, that will take us all over.
So I guess all of these questions and sort of this potential leads us to interoperability, where we're able to enhance the system sort of as a whole across Canada. Again, this is what it would look like. And then these are some potential ideas about how we can really bring CANImmunize, across Canada. So, for instance, Nunavut has no immunization information system, and that's something that we've kind of noticed and we've targeted. So, if we're able to build a system here that's working really well, then we're able to help facilitate that in the northern regions. That would, of course, help to get information to the right individuals, to track, to make sure that individuals are coming back for their appointments. And of course that would enhance sort of the communication and the rapport between the individual and the patient. As Dr. Wilson mentioned, the Canadian vaccine catalog and the clinician-friendly pick list terminology, which is incorporated in Ontario. And then of course mobile barcode scanning as well. So I think this is just a sort of a great representation of how technology and healthcare are really coming together in order to improve, lives at the user level, at the physician level, at the public health level. So I guess I'll move on. We've had quite a good conversation, so thank you everybody. So while we, in the midst of creating this tool for Canadians, we noticed that there is an opportunity to help newcomers in Canada. So we started with a question: how can we use the CANImmunize platform to help simplify and encourage immunization among newcomers to Canada? And then we turned to something that we know. Refugees and newcomers have high rates of mobile and smartphone use. A lot of them are connected to the Wi-Fi, and their phones are really, integrated. It's an integral part of their lives, not only to stay connected with friends and family from back home, or who, for various reasons have been separated, but also to get information about where they are. Be able to change the language to be able to communicate with people in their new countries, whether that's, something like a family doctor or something as simple as getting from point A to point Z. So of course, there have been a couple of different articles. Phones are now indispensable for refugees. Published in the Globe and Mail, medical apps have proven indispensable for doctors in Syria. Of course, UNHCR, they've gotten a couple different actors, to try and sort of raise awareness about this. So of course, as all of you may know, there are a couple challenges that are faced by healthcare providers with respect to newcomers. I mean, I can think of a couple myself, not being, a family physician, but language barriers, or, being faced with individuals who are new to Canada and have no records, right? Any other examples from your sort of practice? No?
Translating what the vaccines are.
Yeah.
Yeah.
But no, multiple records in different places, they've received them on immigration, on, so you've got 3 different sites of collection vaccines, trying to integrate that into the picture.
And that tends to be sort of the least of their concerns often. That's at the bottom of the priority list.
Yeah.
And it gets forgotten also by us, by the practitioners, because there's like 8 other problems that need more urgent attention before. So it tends to kind of fall off the radar.
I'm not sure it's always the newcomer's priority.
No.
That's the other issue. They're getting a
Off their
house,
priority list.
getting a
Absolutely.
job, yeah.
That's what I mean.
Yeah, absolutely. And, being able to, like the Canadian system, right, like adapting to that and trying to sort of inform them that this is an important decision and this is quite important to help keeping your family safe.
I am Allie, and depending where you're from as well, even being aware that vaccines are available free of cost. What Canada requires children to have to go to school, things like that may not be, coherent across different countries and areas, right?
Absolutely. And I think this is another example of how, something like the Ottawa Public Health Reporting Tool, being able to sort of make that easier for them and say, yes, you can enroll your children in school, and one of the sort of requirements is to send the immunization records. Well, here is sort of an easier way for you to do that. But just as much, these newcomers come to Canada or different countries, and they also face difficulties, right? Series completion, it may have gotten started overseas, and then we don't know if there was follow-up. We don't know if there was a second dose that was administered. The legitimacy, of course, of the records, if they do have records with them and they present it to you, right? Like, are those legitimate? But then, of course, navigation. They have to kind of come to a new country, and they all of a sudden have to learn how not only does healthcare work in Canada, but how do vaccinations work? And then, of course, we can get down to the language and the health literacy. So understanding sort of the process of vaccinations and what they cover and sort of what the diseases are that the vaccinations protect against. So we developed a study, and this study is the feasibility of a newcomer needs assessment for a vaccine tracking mobile app, so using CANImmunize. Some of our objectives were to determine the feasibility of this in order to increase health literacy amongst newcomers, but then also ensure on-time vaccination for these individuals in Canada. Determine newcomer smartphone and mobile app usage sort of based on their previous and current smartphone use, and understand how many individuals speak, read, and write in English, French, Arabic, Nepali, Somali, Swahili. Now, these languages were based off of feedback from the Ottawa Newcomer Health Centre, which is the location that we've been working very closely with. They hold a vaccine clinic every second week. So I have been going and I've been interacting with these individuals every second week in order to ask these questions and sort of find out a bit more information about their vaccine tracking behaviors and, of course, their smartphone use. So these are some of the numbers that the ONC receives in terms of newcomers. This was 2015. Of course, that number has gone up a bit more given more newcomers to Ottawa. So we developed a 17-question survey, quite easy and straightforward, asking questions about language and smartphone use, previous vaccination tracking sort of mechanisms. We hope to get 50 participants enrolled in the study. And we would obtain the consent from the individual to participate. They would fill out the questionnaire with me if they understood English or French. I've been very fortunate to work with some of the interpreters at the clinic. So if they do have a couple of moments to spare, then they've been really, really helpful, and they've been able to help answer the surveys for the individuals. And so these are some examples of the questionnaire. And I guess our sort of goals for this are to help inform the changes to CANImmunize to better serve these individuals, to assist in app translation based on the languages at the newcomer clinic. We want to understand sort of the best format for displaying information. So if we do see that there are a lot of people that come in and they're able to speak a certain language, but they aren't necessarily able to read or write in that language, then we would have a look at sort of modifying the app to better meet their needs, to make sure that they're still understanding the immunization content, and they're understanding how to receive reminders and vaccinate and make appointments with their family physician. And then, of course, what type of information is needed in order to get vaccinated? Does that mean, to notify them about clinics in their area that they can go to, or, to speak with their family doctors, etc. So there is a lot of text, I'm sorry. But as of today, we have 32 out of the 50 participants in the study. So we have been running this for a couple months, but as I said, every 2 weeks, we'll get, I guess on average, 6 or 7 individuals that come into the clinic that participate. I think I've only had about 1 family that have said no to participating in the study, and that was because they had a secondary commitment. So we've been quite fortunate. I've been able to sit down with these individuals and ask them these questions. So 34% of people surveyed were either from Iraq, Libya, or Syria, indicating a large Arabic-speaking population. About half of them have kids, and 50% of those have said yes to their children being immunized before coming to Canada. 34% didn't track their immunizations in their home countries. So we're going from not being able to, or not tracking at all, to suddenly, asking individuals to complete these yellow cards, in languages that they probably don't understand. And so how can we facilitate that for them? However, almost 94% of the survey participants own smartphones. Most of those are Androids. We've had a lot of Samsung devices. And then the following 72% responded yes to using an immunization app if it were translated to their first language. Some of them said no, simply because they said, well, I'm in Canada and I do want to learn English or French. So that's quite nice. Are there any questions so far?
Yeah, just related to the track immunizations, the standard of care now is, I don't think most people track their immunizations here. That yellow card is brought to appointments like your healthcare card.
Mm-hmm.
It's all the information is put in by the healthcare provider team.
Mm-hmm.
So I don't think people actively take a role in tracking immunizations here. They show up with a yellow card as they do, and even if they don't, they still get it. And when they do show up, it will be entered. So I don't think there's active tracking of immunization going on by anybody, newcomer, old settlers. It's not an active process at present. For a very small minority, they may be proactive, but I don't think most people actively track immunizations.
Yeah.
It's done at the healthcare team.
Yeah.
Well, even having experience trying to track down my immunization record, for example, I just started here this week, for example, and I had a TB test done at Ottawa General, and they did not communicate with my doctor's office. So now I had to get my TB test. Public Health had to send me my records, which was not the same as my doctor's records. They had to call and ask them. I still don't have my date that I got my TB test in 2009 from the Ottawa General. It's just like a kerfuffle of confusion and no one's communicating with each other, right? So having all that kind of like one page and being able to see that would be really helpful.
Yeah, when we launched the app, a bunch of people downloaded it and they thought that their immunization record would just show up on their phone.
But that's what you're asking people to do, something they don't have to do right now. That's enter the data in. And
what we're also hearing is they're entering the data in and they're realizing that the yellow card is not accurate. Like a bunch of vaccines that we missed. Because, and then saying, oh, I thought I was sure Johnny got that vaccine, and then they're actually going back to their doctor. Because, you know, if you forget your yellow card on one visit, you get another yellow card.
Yeah.
And then,
Yeah,
Or
because
sheet of
most records
paper.
are collection.
yeah, and then you get like
multiple
5 records for that.
That's right.
And we're gonna add TB in, particularly for none of it.
So just one comment, because Sunnybrook uses MyChart. And MyChart is in the cloud, and it has all the information in it, and in fact, lab results go in it. So I just worry a little bit about this app being separate from something that would be our total health record. So that connectivity, I think I saw a slide that suggests that in the future.
Actually, the Ottawa Hospital is starting to use MyChart on Monday, I think, right? We got
And-
we got this email.
But it's connected
Yeah,
at
you're right.
Sunnybrook where the family doctor gets access, everybody gets access based on the individual suggesting that they are part of the healthcare team. It's not, but this moves to the patient being responsible for their healthcare and having their own records. And we're still afraid to give records to patients, you know?
Yeah. We're, you know, we're exploring how we will do it with CHIO integration. So MyChart is based, what's the name of that company? Epic, right? And they have an app orchard where they allow integrations in. So, you know, again, we want to work with everybody. You've already got that information. Your child goes to a pediatric emergency, you can flow that information into Epic. And vice versa, to get a vaccination in the hospital, it could be updated. We are finding, I mean, one of our models is that it's a lot of information, right? To have your entire chart, so disaggregating the specific area and putting it in context with other information may actually be more user-friendly to a parent. Instead of getting all their information at once, which can be a bit overwhelming. We're going to treat immunization as a specific thing.
I also think the role for a disconnected system, not integrated, you're selling it as this goes with the patient, this crosses province, this goes with you when you travel. So there is a value to it not being part of MyChart. But asking people to do something they don't have to do right now, which is fill it in, track it, is going to be, I think, a barrier to uptake because many people will not. Currently, health professionals have to do that, and if you can find a way of having that work be done by the health professionals entering it, and somehow that's saving them
Even
time
though
or
they don't need
cost.
to track it, that's all these suspension letters are, they need to provide the proof. So it's not the healthcare provider in Ontario that provide the proof of vaccination.
They don't care until they get the suspension letter.
I know, but they're like, the schools are freaking out because they're suspending these kids.
But that's at age 6.
Yeah.
All the
Sure.
immunizations are.
Aren't they tracking it on their yellow card? They bring the yellow card, the doctor enters it. So wouldn't they bring the app and give it to their doctor? And
They
so
don't bring the yellow card.
they
We
don't.
no,
I
very,
don't
very
bring the
often.
yellow card.
But then that means more
No, everybody
That's natural behavior because there's a trust that
We get them a new
for
one every
children,
time.
the system is working. If you show up, they'll remind you and they'll do it and they'll enter it and keep the record.
That's because the doctors.
So you're asking people to take on a responsibility and work that some are going to love, most aren't doing, and I don't see them suddenly starting to do it because it's on their phone and not on the card.
I'm gonna reiterate, this is super interesting, and I had heard of the app having worked with Dr. Wilson in the past couple of years. So I actually have the app, and I myself do not feel prompted to open it and enter it. So that whole notion of the accounts and having it on that cloud and being able to connect with the physician. I mean, at the University of Ottawa Health Clinic on 100 Mary Curie, when you go there, they give you an iPad, and you have to verify all your information. I believe they ask you, have you gotten your flu shot this year? You check that. So if that could be, if you guys could pilot test it with this iPad, if that could be integrated in there and you're prompted, you still have to enter that information. Did you get it? Did you not? And then the nurse at the triage can check that and see and prompt you to get vaccines perhaps that you indicated you didn't receive. Knowing that knowing that.
The account system is absolutely essential. That's like our number one piece of feedback, right? And so, because a lot of people are older and it's hard to do stuff on a phone anyway. If you do it on your computer, it'd be a lot easier. And so we realize the system we have right now is not optimal, and we are iteratively going to do it. And I think the account system is going to open up a lot of possibilities.
But it's just making clear the incentives for people owning their own account, filling it in and doing that work. And building in incentives either for healthcare professionals or individuals to fill it in and keep it up to date. That's when this becomes.
Ideally, this will auto-populate in an imaginary future.
Yes, and that, but that's the ideal. It auto-populates wherever you go, it's with you. But that's sort of like the electronic medical record that's attached to our healthcare funding card. And it's in the ideal future.
We've got 6 minutes left, so
Okay.
whatever messages you want to, make sure that you share, and then we can still continue the discussion.
I
just to
maybe
make sure.
maybe 3 slides. So in order, sort of the outcomes that we want from this sort of needs assessment is to be able to offer an app that looks like this. So a translated app that allows individuals who speak different languages be able to access the same information as they would in English and French. Of course, there are some challenges, as I'm sure everyone who's worked with, different populations have experienced. I think one of the biggest ones for me, especially, has been trying to be, kind of open and transparent about the objectives of the study, saying that they don't have to participate in the study if they don't want to. But then there are some opportunities. So NeoVac is out of Hamburg. So Germany has actually accepted, the largest number of refugees. I think they're looking at about averaging 300 asylum seekers per month. And so we are working with this. Of course, Dr. Wilson can speak a little bit more, but we're working with them. It's a pilot study, so it's potential to be able to develop sort of a system that would help with immunization tracking for these individuals in Hamburg. And another one is the Refugee Immunization App, REMA, which is another pilot study, and that's sort of joint collaboration between Sweden, Germany, Canada, and Jordan. So just a couple quick takeaway points. So CANImmunize is a valuable tool that can help patients manage their own health information. Reporting to public health is made easier with CANImmunize, as we saw with the Ottawa Public Health reporting pilot. It may be helpful for newcomers to manage their vaccinations and understand immunizations in Canada. Of course, if we look at translating the app and making it sort of simple and easy to follow. And of course, with the right infrastructure and partners, this tool can become international. So thank you.
And it'd be great if, you guys can let your patients know. We can give you posters and stuff. Yeah,
we have a bunch of new materials.
We have posters, we have stickers, we've got a bunch of material. It's great for reporting. It's also just great for them to know what vaccine they're supposed to get before the visit. Just that information roll thing as well. So.
We also came out with a digital comic book. I don't know if you've heard Immunity Warriors, Invasion of the Alien Zombies. We launched.
My kids love that.
Oh,
That's why they go for vaccines. They get soldiers in them.
It's on it's free online, immunitywarrior.com.
Yeah.
You have to look at it. It's flash required. You can't do it on a mobile, but it's on. It's actually on the app as well, and we PDF it in the app.
And I think that, just to speak to the point earlier, that I think targeting kids is such a great way for us to be able to sort of implement that sort of idea that it's really important to get vaccinated, it's really important to stay up to date. And so, so we had a lot of fun. We worked with Algonquin College, and the students there are fantastic. So.
As you're talking about getting tools to help people now as part of your pilot, I think that'll be a major challenge for getting uptake on an immunization app. People don't think about immunizations until they're pregnant or 8 weeks post-delivery. And that's when suddenly it becomes real, and then they forget about it. There are other things. But I mean, most 25-year-olds, unless they're traveling somewhere exotic, aren't interested in it. And finding a way to take that high interest period and connect it there with the information as a package that's linking you. They're all connected with healthcare providers at that time.
Yeah, so we're working with SOGC. There's a lot more. I don't even know the rules for vaccinating pregnant women, right?
And neither do pregnant women.
Yeah.
But they care.
Yeah, so that's what we're working with SOGC, and they're really excited by this, and they're going to try to promote it. Somebody said, it's like when you leave the hospital, they teach you how to use the car seat, and hopefully they'll get you down.
And the kids aren't born yet, so they got a little bit of attention span.
Yeah.
So I think that's.
Well, we're actually doing outreach to all of the major obstetric hospitals in Canada, and just saying, hey, look, it'd be fantastic. Can we partner with you? Can we send you materials to give to the new parents that are leaving, prenatal classes as well, like those are really important. And we're noticing these individuals are trusted for new parents. And so if we can encourage, the pediatricians, the obstetricians, the nurses to be able to relay this information, then hopefully that'll be something that will take away.
For your translated version?
Yeah.
There was one, some pages looked like it was all in Arabic, and then other pages had Arabic and English. I can only advocate to have the English also present, because I have patients who come in and there was a pharmacy that will remain unnamed where the labeling is all in Mandarin, and my Mandarin is limited to about 2 words and no symbols.
Yeah.
So they come in, they go, oh, this is what I'm taking. I'm like, okay, great.
Yeah.
So we need the translation, because they're gonna say, oh, we got these. So in case they use it to actually communicate with the other. Yeah.
Toggle from English to Mandarin, toggle from Mandarin.
Whatever,
to
whichever
French.
way, but I, as a provider in Canada, I'd like to be able to read, despite my limited language skills, I'd like to read what my patients are showing me, or understand it rather.
Absolutely.
Thanks.
One last question.
Third question, just a statement in terms of promoting uptake, nursing, whether through obstetrics, primary care, when you're talking health communication and immunization, nursing is a fundamental role. That's nursing's role, and so making sure that you're actually going through them almost parallel to physicians. I think you will find your advocates.
I've been working with the nurse educators on all of the floors, and like they've been fantastic. A lot of them this is great. So yeah, we'll help you out. So, but of course,
Canadian Nursing Association partners, they're going to.
CANImmunize.ca is where you can find information, links to embedded links for websites, whatever.
And I have some cards, so if anybody would like materials, then we could definitely touch base.
Please remember to fill your evaluation card